Dr. Jan Werbinski, and I am a board-certified OBGYN, immediate past president of the American Medical Women's Association, and the founding director of AMWA's Sex and Gender Health Collaborative. I'm an associate professor emerita at Western Michigan University's Homer Stryker School of Medicine, and for the last 3 years, I have had the privilege of teaching concepts of sex and gender health first, second, and third year medical students. I discovered that the materials located on the Laura W. Bush Institute's sexandgenderhealth.org website are some of the most comprehensive, accessible, accurate, and user-friendly resources available today. They are used by 242 medical schools in 28 countries. They make it easy to learn or teach sex differences in many diseases and conditions. The material I find particularly helpful is the slide library. This library contains 26 PowerPoint presentations which are peer-reviewed and continuously updated and give a great overview of sex differences in various diseases or disciplines. These slide sets are free of charge. You can download 1 or 2 slides or the whole set and use them as teaching tools. I find it useful to add a few slides to any presentation to point out what might not be covered in standard curricula. At least one student every year asks me this question: why was this not covered in the module that we just finished on this topic? And I still don't have a great answer for them. For those of us who teach in schools which utilize team-based learning, the learning modules or case studies on the site are also extremely useful. These employ audio-video modules with avatars to present clinical care from the patient's first visit through diagnostics, pathology findings, education on pharmaceutical and other treatments, to outcomes both good and bad, which might be expected in either a man or a woman. And for students or providers who finish 5 of the modules and answer the questions after each segment, a certificate of completion is generated, and they are offered the opportunity to be listed in AMWA's Sex and Gender Physician Registry. So if you're an educator or in academic medicine or a student in healthcare, I urge you to review the materials on the Laura Bush Institute site. Even if all that you do is add to your current presentation 1 or 2 extra slides which show sex differences, you will be introducing a sex and gender lens to your syllabus. Always ask this question: how would this condition appear in the other sex? I look forward to the time when an individual course in sex and gender differences is no longer needed, and we all pay more attention to sex differences in our everyday curricula. Thank you for listening.